Well, welcome back. Between research and fundraising, the efforts to thwart HIV and AIDS is constantly growing.
One of the organizations we love here at News 6 is Hope and Help. The health center provides treatment and resources for those living with HIV.
And Hope and Help's Community Director Joshua Myers appeared recently on News 6. He's back again today. We're always glad to have him. And Troy Bridges is here as well. Involved many years with Hope and Help's events, and especially the AIDS Walk and building awareness.
And we love it when Josh is here because he has all the good information on how it really helps Central Florida and what this event really means to Central Florida.
Absolutely. Well, Florida ranks #1 right now in HIV and AIDS cases nationally, and then consequently Orlando is #2. So what we're doing with AIDS Walk is we're trying to generate awareness about all the preventative resources available and all the treatment resources available for people affected by HIV.
And those numbers are kind of shocking if you haven't really been involved and don't realize that. So many people think that this is something that only affects one population, maybe gay men, but we're seeing a lot of straight women affected. I mean, this affects everyone.
Absolutely. And when we break down the stats, there are some groups that are more susceptible to HIV than others for various reasons. For example, let's look at the Black community. Black people accounted for 13% of the nation's population in 2017. However, they accounted for about 46% of all new HIV transmissions. Oh, wow. That's astronomical. So we're asking, why is this happening? You know, what are the barriers to care? What are the reasons people are living with HIV, and how did they get there? So with the resources that we're offering at Hope and Help, which is targeted testing in areas that are much more susceptible to HIV, we also partner with different organizations to offer co-located testing, and we have a great prevention team and case management team. So for those living with HIV, we can help you mitigate the issues associated with living with HIV, such as a lack of finances for housing, legal resources, food in your home. We offer all of that for you so that you can live your best life and get in care and stay in care.
Do you think a lot of people, especially in the younger population, maybe don't take prevention as seriously because, you know, back in the 80s, it was a very serious thing as far as it was always a death sentence. And now with treatment, a lot of people are living so much longer. Do you think that maybe some of the younger people who weren't around in the 80s to see all of this just don't take it as seriously as we should?
Absolutely, and for many reasons. One thing that we often see with our folks that come through our doors is, you know, I'll just take a pill and I'll be fine. It's okay. You know, I spoke with Tara, one of the producers here, and she talked about an emergency room nurse who she knows, who just talks about the youths that come in and they just seem to be careless about having an STD or having HIV. And we just want the kids to know that you can prevent these things if you just use condoms. You talk to your partners about safer sex techniques, and talk to a medical professional about ways that you can prevent yourself. You know, get on PrEP. And you know, it's just really sad sometimes, but we want the kids to know that we're there for them. We want to be able to get into the school systems a little bit more. We want to partner with PTA groups and any other youth organization available so that they know that there are resources available and they don't have to live with HIV. They can prevent it by using those resources.
And one way to get young people involved is to have fun events, which this event, AIDS Walk, every year is. It can be a lot of fun.
Oh, yeah.
Talk about ways to overcome the stigma, because many people who are living with HIV feel, you know, they're not comfortable to share that, how to overcome that, as well as people who maybe are afraid to get tested. I know people who have talked about being afraid to get tested even though they know they've been doing things that may be risky.
Yeah. Well, we believe that stigma is in and of itself a disease. You know, there are so many people who, even when I go to pitch for sponsors or donors, or maybe talk to a different community group, the first assumption is, well, when were you diagnosed? And you know, I don't have HIV, you know, but I'm passionate about the cause. I'm passionate about the people that are susceptible to HIV. And what we want to do is educate people. When we educate people about HIV and what it is, how it's acquired, and all the resources available to prevent and treat it, we reduce stigma. And if we can do that as much as possible, that's going to be a great thing.
Yes, it is.
And
Thank you.
the big event,
Yes.
you are emceeing it along with
Eric
Eric
Sandoval,
and this is
absolutely.
on the 27th, right, Josh?
Absolutely.
Not this
7:38.
weekend, but next.
Yeah, and you're supposed to walk 2 laps
Two
around Lake
laps.
Erin, not
Julie has
one,
been there
as
many
Troy
years.
and I always do.
And we're gonna do
whole laps.
We're gonna do both laps.
We'll
I
do both
promise.
laps.
And
You're
steps
saying,
in it. And then
Yeah.
you go out for breakfast.
Right.
yes, and
Exactly.
we will continue this conversation. Thank you so much.